my name is Brandon.
Hi, my name is Yadelani.
Hi, I'm Megan.
And we all believe that X-rays matter. And we all agree that X-rays matter. Today I will discuss the importance of patient history, prep for different studies, patient care, different types of contrast and their purpose, and why do a CT.
And I will be talking about the importance of patient medications, pre-medication for contrast, contraindications to having a CT scan, CT accessories such as power injector, bed straps, etc. We will be labeling a CT anatomy of a chest with and without contrast, abdomen with and without contrast, pelvis with and without contrast, and head with and without contrast.
And I'm going to be talking about the important lab values, CT physics, CT artifacts, and CT windowing.
Computed tomography. The term computed tomography, or CT, refers to a computerized X-ray imaging procedure in which a narrow beam of X-rays is aimed at a patient and quickly rotated around the body, producing signals that are processed by the machine's computer to generate cross-sectional images or slices of the body. These slices are called tomographic images and contain more detailed information than conventional X-rays. Once a number of successive slices are collected by the machine's computer, they can be digitally stacked together to form a three-dimensional image of the patient that allows for easier identification and location of basic structures as well as possible tumors or abnormalities. Preparing for a CT scan. Wear comfortable, loose-fitting clothing to your exam. You may be given a gown to wear during the scan. Metal objects, including jewelry, eyeglasses, dentures, and hairpins, may affect the CT images and should be left at home or removed prior to your exam. You may also be asked to remove hearing aids and removable dental work. You may be asked not to eat or drink anything for several hours before the scan, especially if a contrast material will be used in your exam. You should inform your physician of any medications you are taking and if you have any allergies, especially the contrast materials. Also, inform your doctor of any recent illnesses or medical conditions. And if you have a history of heart disease, asthma, diabetes, kidney disease, or thyroid problems, any of these conditions may increase the risk of an unusual adverse effect. Please bring a list of your current medications, prescriptions, over-the-counter medications, and vitamins. Women should always inform their physician or technologist if there is any possibility that they are pregnant. If your infant or young child is having a spiral CT, there are measures that can be taken to ensure that the test will not cause anxiety for either the child or the parent. Importance of patient history. Patient history provides context, is used to determine the appropriate modality, guides implementation of the best protocol for answering diagnostic questions, and guides patient positioning, used for intravenous or contrast agents, timing of scanning. Patient care information. If contrast or dye was used during the procedure, you may be monitored for a period of time for any side effects or reactions. If you notice any pain, redness, and or swelling at the IV site after you return home following a procedure, you should notify your doctor, as this could indicate an infection or other type of reaction. If you are given contrast by mouth, you may experience diarrhea after procedure. Otherwise, there is no special type of care required after a CT scan of the chest, or etc. You may resume your usual diet and activities unless your physician advises you differently. Your doctor may give you additional or alternate instructions after procedure, depending on your particular situation. Bring a family member or friend with you if you need to wait for examination results. They can help support you during and after the examination. They can also drive you home if you have sedative medication during the examination. If you do take sedative medication, you cannot drive yourself. Different types of contrast. During many computed tomography examinations, patients may be asked to take special contrast agents orally, rectally, or via injection. Intravenous, oral, and rectal CT contrast are pharmaceutical agents, liquids, and are sometimes referred to as dye. CT contrast is used to make specific organs, blood vessels, and or tissues stand out with more image contrast to better show the presence of disease or injury. Thus, CT contrast highlights specific areas of the resulting CT image or dyes. Different types of contrast blocks X-rays from passing through the body. Iodine-based enhanced CT images. Barium sulfate enhances images of gastrointestinal tract. Thank you. Why a CT scan? In an emergency room, patients can be scanned quickly, so doctors can rapidly assess their condition. Emergency surgery might be necessary to stop internal bleeding. CT images show the surgeons exactly where to operate. Without this information, the success of surgery is greatly compromised. The risk of radiation exposure from CT is very small compared with the benefit of a well-planned surgery. CT scanning provides medical information that is different from other imaging examinations such as ultrasound, MRI, PET, or nuclear medicine. Each imaging technique has advantages and limitations. The principal advantages of CT are its abilities to 1. Rapidly acquire images. 2. Provide clear and specific information. 3. Image a small portion or all the body during the same examination. No other imaging procedure combines these advantages into a single session.
It's important to know the patient's medications. That's why it is advised to the patient to bring a list of all the medications they take. This better manage the patients taking certain medications prior to the exam. For instance, being aware of taking metformin will guide response in patients with post-contrast acute kidney injury. Gives more information on patients' health status. Can give information quickly to those responding to emergency situations, and there's a few contraindications. One of them will be pregnancy or a young age, but in these cases we still do CT scans to pregnant women and young kids. Pre-medication for contrast. It is used primarily to reduce adverse events. Corticosteroid aims to reduce allergic reactions in high-risk patients. Some of the risk patients might include leukocytosis, hyperglycemia, infection, drowsiness, allergic or physiologic reactions, delaying diagnosis. Oral medication is preferred over IV prior to the CT scan, and the radiology technologies should be prepared for breakthrough reactions. And some of the breakthrough reactions could include nausea, vomiting, fever, drowsiness, and headaches. Severe delayed non-cutaneous contrast reactions, while extremely rare, have been described, including severe hypotension and cardiopulmonary arrest. However, at least some of the events may have been due to etiologies other than ICM. Iodine intravenous contrast media are pharmaceuticals and have potentially dangerous and life-threatening adverse reactions. Allergy to iodine, toxic goiter of the thyroid, planned radioiodine treatment of thyroid cancer, contraindication against the use of ion-based contrast media in patients just like children below 2 years of age or pregnant women. Contrast can cause acute renal failure. This risk is significantly increased in patients with chronic renal disease, diabetes, heart failure, and anemia. And that's one of the reasons why it's very important to know if the patient that is diabetic is taking metformin. CT accessories.
One of the CT accessories is the power injector, which injects contrast media. This allows for the adequate table movement and avoid tension in IV line. We can also use bed straps, which is used to maintain correct position, hold still during examination safely. We can also use a pillow and is used to maintain correct position and comfort for the patient. On this slide, we will discuss the CT anatomy of a chest with and without contrast. The first image to the left is a CT scan of the chest with contrast, which shows large left lung and hilar mass, as well as invasion of left pulmonary artery and a lung cancer. On the second image to the right, it's a normal CT chest without contrast. RA in blue is the right atrium. The RV in blue is the right ventricle. The A is aorta, which is in red, and LA is the left atrium, which is the orange. Now we will discuss a CT anatomy of the abdomen with and without contrast. The first image is a CT scan of the abdomen without contrast, the one on the left. Thickening of aorta wall in A and B. Intimal calcification in A. Second image is with contrast. Coeliac aces encased in B. On this slide, we will discuss a CT anatomy of the pelvis. On image A to the left is a CT scan without contrast of the abdomen and pelvis. It shows the kidneys and pelvic-calyceal system. On image B to the right is a CT scan with contrast, and it shows kidneys and right renal vein identified by the blue arrows. On this slide, we will discuss a CT anatomy of the head. First image is a non-contrast CT. It shows parietal hematoma and subarachnoid hemorrhage. The second image to the right is a CT contrast showing basal ganglia and occipital cortex lesion.
Knowing the different lab values is an important step in making an informed clinical decision as a radiology technologist. Diagnostic and laboratory tests are tools that provide invaluable insights and information about the patient. Lab tests are used to confirm a diagnosis, monitor an illness, and the patient's response to treatment. Important lab values in CT are BUN, creatinine, and HCG. CT physics. Each time the X-ray source completes one full rotation, the CT computer uses sophisticated mathematical techniques to construct a 2D image slice of the patient. The thickness of the tissue represented in each image slice can vary depending on the CT machine used, but usually ranges from 1 to 10 millimeters. When a full slice is complete, the image is stored and the motorized bed is moved forward incrementally into the gantry. The X-ray scanning process is then repeated to produce another image slice. This process continues until the desired number of slices is collected. In computed tomography, CT, the term artifact is applied to any systematic discrepancy between the CT numbers in the reconstructed image and the true attenuation coefficients of the object. CT images are inherently more prone to artifacts than conventional radiographs because the image is reconstructed from something on the order of 1 million independent detector measurements. The reconstruction technique assumes that all of these measurements are consistent, so any error of measurement will usually reflect itself as an error in the reconstructed image. The types of artifact that can occur are as follows. Streaking, which is generally due to an inconsistency in a single measurement. Shading, which is due to a group of channels or views deviating gradually from the true measurement. Rings, which are due to errors in an individual detector calibration. And distortion, which is due to the helical reconstruction. CT windowing. Windowing, also known as a gray level mapping, Contrast stretching, histogram modification, or contrast enhancement is the process in which the CT image grayscale component of an image is manipulated via the CT numbers. Doing this will change the appearance of the picture to highlight particular structures. The brightness of the image is adjusted via the window level. The contrast is adjusted via the window width.
In conclusion,
Exclude all the chatter.
X-rays matter. We hope you learned something today and enjoy your presentation.